A nervous patient's exam revealed a truth the billionaire doctor didn't expect. Hello everyone. Before we begin today's story, I have a small favor to ask. Please hit subscribe and turn on the notification bell so you never miss our channel's new videos. It is quick, free, and the best way to support us in bringing you more dramatic stories. Your support means the world to us. Where are you watching from? Drop your city or country in the comments below. Thank you very much. Now, let us return to the main character. She sat alone at the far end of the waiting room, shoulders slightly hunched, hands folded so tightly in her lap that her fingers had begun to turn pale. The hum of the air conditioner filled the space, steady and impersonal, broken only by the soft click of a keyboard behind the front desk. A wall-mounted television played a morning news segment that no one was really watching. Her name was Claire. She was 26 years old, and she had almost turned around and left twice before finally pushing through the glass doors of the clinic. This was supposed to be a routine medical exam. That was what she kept telling herself. A simple checkup, in and out, no reason to be afraid. But fear had followed her inside anyway. Every few seconds, she adjusted the strap of her worn canvas bag, as if it were the only thing keeping her anchored to the chair. The bag held everything she owned that mattered: her wallet, her phone, a folded letter reminding her how long she had postponed this appointment. Too long. When the nurse called her name, Claire flinched. She stood up slowly, her sneakers squeaking faintly against the polished floor, and followed the nurse down a narrow hallway that smelled faintly of disinfectant and clean linen. Each step felt heavier than the last. Her heart beat faster, not from pain, but from the weight of memories she did not like to revisit. Inside the exam room, the lights were bright but not harsh. Everything was white and orderly. The exam table was covered with crisp paper that crinkled softly as she sat down. She clasped her hands together and stared at the floor, counting her breaths. She did not notice when the door opened again. Dr. Ethan Cole stepped inside, tablet in hand, his expression calm and professional. In the medical world, his name carried weight. A renowned physician, a billionaire by inheritance and innovation, a man who had built private clinics that rivaled hospitals in both technology and reputation. To him, this was another appointment in a tightly packed schedule. He glanced at her chart, then at the woman sitting tensely on the exam table. Her posture caught his attention immediately. Patients were often nervous, but this was different. This was not impatience or mild anxiety. This was fear held deep, carefully contained. "Good morning," he said gently, his voice measured and clear. "I am Dr. Cole. I will be taking care of you today." Claire nodded but did not look up. As he asked routine questions, her answers came softly, sometimes barely above a whisper. She apologized more than necessary, for being late, for asking questions, for hesitating. Ethan slowed his pace without consciously deciding to. He set the tablet down. He gave her time to breathe. Years of training had taught him how to read symptoms, but this was not written in any chart. This was something else. When the exam began, everything was done with professionalism and care. Clear explanations, respectful distance, no rushed movements. Yet even then, he noticed subtle signs: the tension in her shoulders, the way she braced herself before each instruction, the way her eyes briefly closed, as if preparing for something far worse than a routine procedure. And then, in a moment that should have been ordinary, Ethan saw something in the results that made him pause. It was not what he expected. It was not routine at all. For the first time that day, the billionaire doctor stopped thinking about time, schedules, and efficiency. Because sitting in front of him was not just another patient. She was someone carrying a truth that had been ignored for far too long. She had not always been this afraid of doctors. As Claire sat on the edge of the exam table, waiting while Dr. Cole reviewed her chart outside the room, her mind drifted backward, to a time when hospitals did not feel so heavy, so suffocating. 3 years earlier, she had still believed that ignoring pain would make it disappear. Back then, she was working 2 jobs. Mornings at a small grocery store on the edge of town, evenings cleaning offices after everyone else had gone home. No health insurance, no savings. Just enough money to cover rent, groceries, and gas if she was careful. When the discomfort first appeared, she told herself it was nothing. Stress, fatigue, a long week. Then weeks turned into months. The pain came and went, quiet enough to dismiss, sharp enough to remind her it was still there. Each time she considered seeing a doctor, something stopped her. The cost, the time off work she could not afford, and underneath it all, a deeper fear she rarely admitted, even to herself. What if they found something wrong? So Claire learned to endure. She learned to smile through shifts, to excuse herself to the restroom when the discomfort became too much, to tell coworkers she was fine when they noticed the way she sometimes went still, her hand pressed lightly against her side. She told herself she would make an appointment next month, then the month after that, until the letter arrived. It was brief and impersonal, printed on plain white paper, a reminder that she was overdue for an exam she had been referred for nearly a year ago. At the bottom, a final line caught her attention. "Please do not delay further." She had read that sentence over and over, standing in her small kitchen, the refrigerator humming behind her. That was the night she finally cried. Not loudly, just quietly, leaning against the counter, realizing how alone she had been trying to handle everything. That was when she made the appointment at this clinic, one of the few places that accepted patients like her. Sliding scale, long wait times, no judgment, at least on paper. Now, sitting in the exam room, all of that history pressed against her chest. The door opened again, and Dr. Cole stepped back inside. Claire straightened instinctively, her hands tightening together. She expected impatience, or pity. She had seen both before. Instead, he pulled a chair closer and sat down, placing himself at eye level with her rather than towering over the exam table. "I want to ask you a few more questions," he said calmly, "and you can take your time answering." She nodded, swallowing. As he spoke, the questions shifted gently away from symptoms and toward her experience. How long she had been feeling this way, whether the pain interfered with her daily life, whether she had seen anyone about it before. At that last question, her voice faltered. "No," she said, "not until now." Dr. Cole did not react the way she expected. He did not sigh. He did not lecture her. He simply nodded, as if that answer told him more than she realized. "When was the first time you noticed something felt wrong?" he asked. Claire hesitated, then told him the truth. About the months, about the years, about the fear of missing work, of bills piling up, of being told something she could not fix. As she spoke, the words came faster, as if once released, they could not be stopped. She apologized halfway through, embarrassed by how much she was saying. "You do not need to apologize," he said quietly. For a moment the room felt different, less clinical, less cold. Dr. Cole listened without interrupting, his attention fully on her. In that silence, Claire realized something she had not expected. This was the first time someone had asked her these questions, and actually waited for the answers. And as Ethan Cole listened, a different realization began to settle in his own mind. This was not just a delayed exam. This was a pattern of fear, neglect, and survival that had allowed a serious problem to hide in plain sight. And whatever the results showed, one thing was already clear. Claire had not failed to take care of herself. She had simply never been given the chance. Dr. Cole stood near the counter, reviewing the information he had just entered, but his attention kept drifting back to the woman sitting quietly on the exam table. Claire's shoulders were still tense, but there was a subtle change now. She was no longer bracing herself for impact. She was waiting. Years of medical training had taught Ethan Cole how to separate emotion from diagnosis. It was a skill that had helped him build an extraordinary career. Precision, distance, efficiency. Those principles had made him one of the most respected physicians in the country, and eventually one of the wealthiest. But something about this case refused to stay neatly contained. "Before we continue," he said, turning back toward her, "I want to explain exactly what we are doing and why. Nothing will happen without you understanding it first." Claire nodded again, her fingers loosening slightly in her lap. As he spoke, his voice was steady and unhurried. He explained each step of the exam in plain language, avoiding jargon, watching her face for any sign of confusion or fear. When she hesitated, he paused. When she asked a question, he answered it fully, without rushing her along. This was not how he usually worked. Normally, his days were segmented into tight blocks of time. Appointments stacked back to back. Decisions made quickly, confidently. Patients trusted him because he was decisive. But with Claire, decisiveness felt like the wrong approach. She needed clarity more than speed. As the examination continued, Ethan noticed details that did not appear in the chart. The way she tensed before certain movements. The slight wince she tried to hide. the instinctive apology whenever she thought she was taking too long. "I am sorry," she said again at one point, her voice small. "I know I am probably making this more complicated than it needs to be." He met her eyes calmly. "You are not," he said, "and you are not doing anything wrong." The words landed more heavily than he expected. For a brief moment, Claire froze, as if she were unsure how to respond to kindness that did not come with conditions. Then her shoulders sagged, just a little, as if something she had been holding up for years finally allowed itself to rest. When the exam concluded, Ethan stepped back, his expression thoughtful. "I need to review your results more carefully," he said. "There are a few things I want to look at in more detail." Her breath caught. "Is it bad?" she asked. "It is too early to say," he replied honestly. "But I want to be thorough. That is important." He left the room quietly, closing the door behind him. In the hallway, the clinic moved on as usual. Phones rang, nurses passed by with charts and trays. Somewhere down the corridor, a printer hummed steadily. Ethan leaned against the counter and studied the data on his tablet. The numbers did not align the way they should have. Certain markers were elevated, others suppressed. Not alarming on their own, but together they formed a pattern he had seen before. A pattern that often went unnoticed when patients delayed care for too long. He felt a familiar tightening in his chest. Not fear, responsibility. This was the part of medicine that had first drawn him in, long before wealth and recognition entered the picture. The moment when knowledge mattered, when attention could change the course of someone's life. And yet, somewhere along the way, he had started to forget that. Ethan glanced at the clock. He was already behind schedule. 2 patients waiting. A meeting later that afternoon he could not easily reschedule. Still, he did not move. Inside the exam room, Claire sat alone again, staring at the closed door. Her mind raced through worst-case scenarios, each one heavier than the last. She thought of her jobs, her small apartment, the careful balance she maintained every month just to stay afloat. She told herself not to panic. She told herself she had done the right thing by coming. When the door finally opened, Dr. Cole returned. His demeanor unchanged, but his eyes more focused than before. He pulled the chair back into place and sat down. "Claire," he said gently, "there is something I want to discuss with you." Her heart pounded, but she met his gaze. In that moment, both of them understood something important. This appointment was no longer just a routine exam. It was the beginning of a conversation that could not be rushed. Dr. Cole did not speak right away. He allowed the silence to settle between them, not as an absence, but as space. Claire noticed it immediately. Most people rush to fill quiet moments, especially when delivering serious information. He did not. He adjusted the tablet in his hands and looked at her, not at the screen. "I want to be very clear," he said. "What I am seeing does not mean something terrible has already happened, but it does mean we need to take this seriously." Claire nodded slowly. Her pulse thudded in her ears, but his tone anchored her. He explained the results carefully, step by step, translating numbers into meaning. He told her what was within normal range. He told her what was not. He told her what could be managed, and what needed attention sooner rather than later. He did not dramatize. He did not minimize. "This is something that often develops quietly," he said, "especially in people who have been under prolonged stress or who delay care. It does not announce itself loudly at first." Claire listened, her hands resting flat on her thighs now instead of clenched together. Fear still hovered, but it no longer felt wild. It had shape. "So, what happens next?" she asked. "That depends on you," he replied. "There are additional tests I would recommend. Imaging, blood work, nothing invasive today. We go at your pace." Her breath released in a slow exhale she did not realize she had been holding. She hesitated, then asked the question that had been pressing against her chest since the beginning. "And the cost?" Ethan paused, just briefly. "Let us focus on your health first," he said. "We will talk about logistics. I promise you will not be left guessing." Something in his response unsettled her in a way she could not immediately name. It was not suspicion. It was unfamiliar relief. He stood and explained what would happen next, then left the room to arrange the necessary steps. Claire was escorted down the hall to a diagnostics area, where a technician prepared her for the first set of tests. Everything was explained again. Consent forms were read aloud. Questions were encouraged. She kept waiting for the moment when someone would become impatient, when she would be treated like a problem instead of a person. It did not come. When she was brought back to the exam room, Dr. Cole was waiting. By now, his schedule was undeniably off. Notifications had stacked up on his phone. A message from his assistant sat unread. Still, he remained seated when she entered. They reviewed the next set of results together. Some were reassuring. Others confirmed his earlier concern. Ethan felt the familiar mental shift that came with clarity. The pieces were aligning. The truth was no longer vague. "This explains a lot of what you have been feeling," he said. "The fatigue, the discomfort, the inconsistency." Claire swallowed. "Is it treatable?" "Yes," he said, "but it requires consistency, follow-up, and support." Support. The word echoed. She looked down at her hands again, the old habit returning. "I do not know how much of that I can manage," she admitted quietly. "I have work. If I miss too many days, I lose hours. If I lose hours, I lose my apartment." Ethan did not interrupt. He did not offer solutions yet. Instead, he said something unexpected. "I want you to know something," he said. "Needing help does not mean you have failed, and delaying care does not make you irresponsible. It makes you human." Claire's eyes stung. She blinked quickly, embarrassed. He slid a tissue box closer without comment. For a moment, the roles between them felt less rigid. Doctor and patient remained, but something softer threaded through the space. Mutual recognition, respect. Ethan realized then how long it had been since he had allowed himself to sit with a patient like this, not rushing, not shielding himself behind expertise. This was why he had chosen medicine before wealth complicated everything. By the time the plan was outlined, Claire felt overwhelmed, but not lost. She knew what would happen next. She knew when she would return. She knew she would not be navigating this alone. As she gathered her bag to leave, she paused at the door. "Dr. Cole," she said, "thank you for explaining everything." He met her gaze. "We will take this one step at a time," he said. "You did the hardest part already. You came." When she walked back through the waiting room and out into the afternoon light, the world felt unchanged. But something inside her had shifted. And inside the clinic, Ethan Cole remained seated for a long moment after she was gone, aware that what had just begun was not only a course of treatment, it was a responsibility he was no longer willing to rush past. Dr. Cole returned to his office late that evening, long after the clinic had quieted. The hallways were dim now, lights lowered to their nighttime setting, the steady rhythm of the building slowing as staff filtered out one by one. Ethan loosened his tie as he walked, but the familiar relief of the day ending did not come. His mind was still in the exam room, still with Claire. He sat at his desk and pulled up her file again. He had already reviewed the results twice. A third time did not change the facts, but it deepened their meaning. The condition was real, progressive if ignored, manageable if addressed early enough. The signs had been present for a long time, quietly worsening while she pushed herself through exhaustion and pain. What stunned him was not the diagnosis itself. It was how easily it could have been missed. If she had gone to a rushed clinic, if she had been dismissed as anxious, if she had apologized one more time and left without answers. Ethan leaned back in his chair, staring at the ceiling. For years, he had prided himself on efficiency, on building systems that moved fast, clinics that processed thousands of patients a month, technology that optimized outcomes. It was what made him successful. It was what made him wealthy. But Claire's case exposed a truth he had not wanted to confront. Efficiency without attention left people behind. The next morning, Claire returned for follow-up testing. She arrived early, sitting in the waiting room with the same worn bag at her feet. But her posture was different now. Still cautious, still reserved, but steadier. She did not flinch when her name was called. Dr. Cole met her himself instead of sending a nurse. "I wanted to check in with you before we continue," he said as they walked down the hallway together. She nodded. "I did not sleep much," she admitted, "but I am here." That mattered more than she realized. As the day unfolded, the final pieces fell into place. The tests confirmed what Ethan had suspected. The truth was no longer abstract. It had a name, a timeline, a clear path forward. When he sat across from Claire again, the weight of responsibility settled fully on his shoulders. "There is something important I need to tell you," he said. She clasped her hands together, waiting. "This condition developed slowly," he continued, "and because of that, it often goes undiagnosed for years. Not because patients ignore it, but because life forces them to." Her eyes flickered. She understood. "If it had continued unchecked," he said, "the consequences would have been far more serious." Her breath caught. "But you came," he added, "and that changed everything." Tears welled in her eyes, uninvited. She tried to blink them away. "I kept thinking it was my fault," she whispered, "that I waited too long." Ethan shook his head. "It was not your fault. It was a system that asked you to survive first and take care of yourself later." The words surprised even him. In that moment, Claire saw something in his expression she had not seen before. Not authority, not distance, but resolve. "We can treat this," he said, "and we will, together." They discussed the plan: medication, lifestyle adjustments, regular monitoring. Nothing promised instant relief, but everything pointed towards stability and recovery. As the appointment ended, Claire stood slowly, absorbing everything she had heard. "Dr. Cole," she said, hesitating, "why did you take so much time with me?" The question hung between them. He answered honestly, "Because missing this would have been unacceptable." She nodded, not fully understanding yet what he meant. As she left the clinic that day, a sense of fear remained, but it was no longer paralyzing. It had been replaced by something new, possibility. And as Ethan watched her go, he realized the truth that had stunned him most of all. This was not just a patient who needed care. This was a reminder of the kind of doctor he had almost forgotten how to be. The weeks that followed settled into a new rhythm for Claire. Treatment did not transform her life overnight. There were days when the medication left her tired, days when follow-up appointments conflicted with work shifts she could not easily give up. But there was also something she had not felt in a long time: stability. Every visit to the clinic followed the same pattern: clear explanations, no rushing, no assumptions. Dr. Cole remained consistent, not just in his care, but in his presence. He remembered details she did not expect him to remember: which shifts were hardest on her body, how long her commute was, the way she tended to minimize her symptoms before finally admitting the truth. Over time, Claire stopped apologizing every time she spoke. One afternoon, after a particularly long appointment, she noticed the change herself. "I used to feel like I was always in the way," she said quietly as they reviewed her progress. "Like asking for help was some kind of burden." Ethan looked up from the chart. "Do you still feel that way?" She thought for a moment. "Not here." The words lingered. Outside the clinic, Ethan's life continued at its usual pace. Board meetings, expansion proposals, invitations he declined more often than he accepted. The world still saw him as a billionaire physician who had mastered both medicine and business. But inside the clinic, something had shifted. He found himself arriving earlier than necessary on the days Claire had appointments, staying later, reviewing her progress personally instead of delegating it. Not because protocol demanded it, but because he wanted to be certain nothing was missed. One evening, as he walked her to the front desk after an appointment, Claire hesitated. "I might need to reschedule next week," she said. "They cut my hours unexpectedly." Ethan stopped. "Do not cancel yet," he said. "We will work around it." She looked up, surprised. "You do not even know my schedule." "I will," he replied simply. The offer was practical, respectful, and somehow deeply reassuring. As treatment continued, the physical changes became noticeable. Claire's energy improved. The pain that had once dictated her days dulled into something manageable. She laughed more easily, spoke more confidently. Healing, she learned, was not just about the body. During one visit, Ethan paused as he reviewed her latest results. "These are good," he said. "Better than I expected at this stage." Her eyes widened. "Really?" "Yes," he said. "You were doing everything right." The affirmation caught her off guard. She smiled, a small, genuine smile that reached her eyes. That night, after the clinic closed, Ethan sat alone in his office again. But this time, the quiet felt different, less heavy, more reflective. He thought about the systems he had built, the speed he had once valued above all else, and how easily Claire could have been overlooked in that model. He realized something that unsettled him. He did not just care about her recovery. He cared about her, not in a way that crossed boundaries, not in a way that confused roles, but in a way that made him invested in her future beyond lab results and treatment plans. And that realization forced him to confront a deeper truth. Medicine, at its best, was not only about curing illness, it was about restoring trust. As Claire left the clinic that evening, she paused outside the glass doors, feeling the cool air against her face. For the first time since this journey began, she allowed herself to imagine a future that was not defined by fear. Inside, Ethan watched from the hallway as she walked away, knowing that whatever came next, neither of them would be unchanged by this process. Healing was happening, and it was reaching further than either of them had expected. The first real tension appeared quietly. It did not come from Claire's health. Her progress continued, steady and encouraging. It came from everything around them that could not slow down the way the clinic room did. One afternoon, Claire arrived later than usual. Her hair was pulled back hastily, her expression tight. "I almost did not make it," she admitted as she sat down. "My manager switched my shift last minute." Ethan frowned slightly. "Did you want to reschedule?" She shook her head. "No, I cannot afford to miss this." The words landed harder than she intended. As the appointment went on, Ethan noticed the old tension creeping back into her shoulders. Not fear of the exam, fear of consequence. The kind that came from constantly calculating what each hour cost. Afterward, as they reviewed her progress, his phone vibrated on the desk. Once, then again. He ignored it at first, but when it buzzed a third time, Claire glanced at it instinctively and then looked away, embarrassment flushing her cheeks. "I am sorry," she said. "I know you were busy." Ethan picked up the phone and silenced it. "This time is yours," he said. She nodded, but the moment had already shifted. Later that evening, Ethan sat in a conference room overlooking the city, surrounded by advisors and executives. They discussed expansion timelines, clinic performance metrics, staffing efficiency. Numbers moved across screens. Decisions were made quickly. At one point, an executive mentioned patient throughput. "We are still losing time on extended consultations," he said, "especially in the lower-income clinics. We may need to tighten guidelines." Ethan leaned back in his chair. "Tighten how?" he asked. "Shorter appointments, more standardized protocols." The room went quiet. "That is not how medicine works," Ethan said calmly. The executive hesitated. "It is how systems work." That night, Ethan did not sleep well. The next morning, Claire received an email, a polite, automated message reminding her of the clinic's updated scheduling policy. Appointment times would be reduced, follow-ups consolidated. Her stomach dropped. At her next visit, she said nothing at first, but as the appointment progressed, Ethan noticed the familiar withdrawal. "Something is wrong," he said gently. She hesitated, then showed him the email on her phone. "I understand," she said quickly. "I know this is how things work. I just wanted to ask if we could move a little faster next time. I do not want to be a problem." The word cut deeper than she knew. "You were not a problem," Ethan said firmly. She met his eyes, searching for something, reassurance, certainty. "What happens if I cannot keep up?" she asked quietly. "With the appointments, with the schedule." Ethan did not answer immediately. For the first time since they met, he felt the weight of the boundaries between them press in. He was her doctor. He was also the man responsible for the policies that frightened her. "I will not let your care suffer," he said carefully. But even as he spoke, he knew the truth. Good intentions were not enough. As Claire left the clinic that day, the confidence she had built wavered. The fear was not as sharp as before, but it was familiar. And inside his office, Ethan Cole sat alone, confronted by a conflict he could no longer ignore. He could continue protecting patients like Claire one appointment at a time, or he could confront the system he had helped create. Either way, something would have to change, because healing could not exist in isolation, not anymore. Ethan Cole did not make a public announcement. He did not call a press conference or send out a company-wide email filled with polished language. Instead, he started with something quieter and far more difficult. He changed the rules. The following week, Claire arrived for her appointment, expecting to be rushed. She had rehearsed what she would say if the visit felt shorter, how she would accept it without complaint. But when she was called in, nothing felt different. Dr. Cole greeted her the same way, sat at eye level, asked how her week had been before asking how she felt physically. When she hesitated while answering, he waited. Halfway through the visit, she finally spoke up. "I thought appointment times were being reduced," she said carefully. "I did not want to assume, but I was preparing for that." Ethan nodded. "They were, temporarily." Her brow furrowed. "Temporarily?" "I requested an exception," he said, "for patients whose care requires continuity." She looked at him, unsure what to say. "Is that allowed?" He met her gaze evenly. "It is now." Behind the scenes, the change had not been simple. Ethan had spent hours in meetings pushing back against the same arguments he had once accepted without question. Efficiency, cost, optimization. He did not dismiss them, but he reframed them. "Shortening care does not reduce cost," he told his board. "It transfers it to emergency rooms, to long-term disability, to lives interrupted." Some resisted, others listened. He introduced a pilot program, extended care tracks for patients managing chronic conditions, flexible scheduling, integrated follow-ups. No public credit attached to his name. What mattered was that it worked. Claire felt the difference almost immediately, not just in her treatment plan, but in how she moved through her days. Knowing she would not be penalized for needing time allowed her to breathe more freely. She coordinated shifts with appointments instead of choosing one over the other. Her body continued to respond to treatment. Her lab results stabilized. Her energy returned gradually, like light coming back into a room, one lamp at a time. One afternoon, after reviewing her progress, Ethan leaned back slightly and smiled. "You are doing very well," he said. "Better than we projected." Claire laughed softly, surprised. "I never thought I would hear that in a doctor's office." He returned the smile, restrained but genuine. "You earned it," he said. As weeks turned into months, the tone of their interactions shifted subtly. Still professional, still grounded, but warmer, easier. Conversations expanded beyond symptoms. She mentioned books she liked. He admitted he barely read for pleasure anymore. There was no crossing of lines, just recognition. Healing, Claire realized, was not a single moment of relief. It was the accumulation of being taken seriously, again and again. One evening, after her latest appointment, she lingered near the door. "I wanted to tell you something," she said. "I started planning ahead again, not just week to week." Ethan looked up. "That is good. I even looked at classes," she added, almost shy. "Just one, something I always wanted to try." "That is more than good," he said. As she left the clinic that day, Claire felt something solid beneath her hope. Not blind optimism, foundation. And inside the building, Ethan Cole reviewed reports from the pilot program, watching the data confirm what he already knew. When care made room for people, healing followed. For the first time in years, he felt aligned with his work again, not as a billionaire, but as a doctor who had chosen to act. Months later, Claire sat in the same waiting room where her hands had once trembled in her lap. The television still played quietly on the wall. The air conditioner still hummed with the same steady rhythm. On the surface, nothing had changed. But she had. She sat upright now, her shoulders relaxed, her bag resting loosely at her feet. When the nurse called her name, she stood without hesitation and walked down the hallway with an easy confidence she barely recognized as her own. This appointment was different. It was her final scheduled follow-up. Dr. Cole greeted her with the same calm professionalism as always, but there was a warmth in his eyes that reflected the journey they had both walked. They reviewed the results together. Every marker stable, every concern addressed. "You are cleared to move into maintenance care," he said. "No more frequent monitoring, just regular checkups from here on." Claire let out a breath that felt like it had been waiting years to escape. "So this is really it," she said softly. "This chapter, yes," Ethan replied. She smiled, a real smile, unguarded and bright. "Thank you," she said, "for everything." He shook his head gently. "You did the work. I just made sure you were not doing it alone." There was a brief pause, comfortable and reflective. "Claire," he said carefully, "now that your care has transitioned, I want to acknowledge something." She looked at him, curious but calm. "Our professional relationship is changing," he continued, "and with that, I want to be very clear about boundaries. What comes next should never feel like an obligation." She nodded, understanding. "I would like to ask you something," he said. "Outside of this clinic, as equals, only if you are comfortable." Her heart skipped, but not with fear. "I would like that," she said. They did not rush. There was no dramatic gesture, no sweeping declaration. Just a quiet agreement to meet for coffee the following week. A simple beginning built on trust, not rescue. Time passed. Claire continued to grow stronger, not just physically, but in how she carried herself through the world. She took the class she had once been afraid to imagine. She adjusted her work schedule with confidence instead of apology. She planned months ahead instead of days. Ethan watched these changes not as her doctor, but as someone learning who she was beyond the exam room. And in turn, Claire saw him differently too, not as a distant figure of authority, not as a billionaire defined by wealth, but as a man who had chosen to listen when it mattered most. One evening, as they walked together after dinner, Claire stopped and looked at him. "You know," she said, "I used to think healing meant going back to who I was before everything went wrong." Ethan waited. "Now I think it means becoming someone new," she continued. "Someone who knows they deserve care." He smiled. "I think you are right." In the months that followed, the pilot program Ethan had created expanded beyond the clinic. Other physicians adopted it. Other patients found space where there had once been pressure. The impact reached further than any single success story. And late one night, as Ethan and Claire sat together in quiet conversation, he realized something that surprised him. The truth he had not expected during that first exam was not only a diagnosis, it was a reminder that healing is not a transaction, that love grows where dignity is protected, and that sometimes changing one life begins by slowing down long enough to truly see it. Claire had come to the clinic seeking answers. They had both left with something far greater, a future built on trust, care, and the courage to choose humanity first.